Am I saying it
Correct,
right?
Ochiai. Yes, you got it.
Okay, thank you, Dr. Derek, for joining us today. And, I know your publicist had reached out because there is something kind of pertinent in entertainment news, at least, which is Madonna's hip replacement, and it's caused a cancellation of her tours. And, personally for me, okay, she's 63 years old. Most people are headed towards retirement at that time, and it's difficult to sustain that level of productivity she's used to. I'm sure it must be completely stressful and sad for her, but what are the realities around this? And tell us a little bit, Dr. Derek Ochiai, about your practice, what you do. And I know you're an expert to be able to talk perfectly about this issue and with hip replacements. So tell us a little bit about yourself and your thoughts on this latest news story.
Okay, well, I have a hip sports practice. So I do minimally invasive surgery, arthroscopic surgery for athletic hip injuries. That's my entire practice, or the vast majority of that. I'm in Arlington, Virginia, which is inside the Beltway. So, like part of the DC, Maryland, Virginia corridor. And I'm part of a single specialty group that treats sports injuries and does joint replacement.
Wonderful. Okay, so now what is, first of all, tell us a little bit about the process of a hip replacement. I know because I work with a lot of seniors, but I think for the audience, it is somewhat commonplace, right? You get to a certain age and it is something that a lot of our elderly go through.
Yeah, I mean, I wouldn't necessarily call Madonna elderly. Most of the time people will start having pain in their hip. That's like usually the first sign that they do. Either pain in their hip or they notice a lack of motion, like something where it's not the same as it used to be. Like maybe you can't put your socks on the same way, or getting in and out of cars, you have to do it differently. So either pain or loss of motion is usually the first sign that there's something wrong with your hip. A lot of times, people with a hip condition, a lot of times it starts off as something called a labral tear or cartilage tear in their hip, which is typically from the way the hip developed in the early teenage years. So a long time before they started having symptoms, the hip developed in a way that could possibly cause some issues in their hip. And they may have a labral tear in their hip and then have some symptoms, but a lot of times that'll be treated with physical therapy, possible injections. Every once in a while you'll do like an arthroscopic surgery, to treat the shape of the hip and treat the labral tear. That's what I specialize in. When that progresses, then a lot of times you start getting hip arthritis. And hip arthritis is a wearing away of the cartilage. If you think of like the end of a chicken bone, like that shiny gray stuff.
Yes.
So that's normal cartilage in an abnormal specimen because you're eating that potentially. But if you think of like a fork and scraping that cartilage away, that's what arthritis is. It's a wearing away of that cartilage. Mm-hmm. Now, you might scrape it away a little bit and there's still some cartilage left, and that would be like mild to moderate arthritis. Or you can scrape it all away, and that's what some people call bone-on-bone arthritis or severe arthritis, where there's really no icy smooth surface for the bones to move against. They're moving against just bone, and there's no cartilage to.
So with Madonna's high activity and her performances, You believe that wear and tear on the cartilage was accelerated?
Yeah, no, I tell a lot of patients, I tell them that uh, getting hip arthritis from, I'm assuming she has FAI. I haven't seen her x-rays, but the way that her hip potentially was shaped abnormally, the chance of getting hip arthritis is a math equation. It's the amount of deformity or the way the hip developed times the amount of trauma or activity that hip sees. And certainly Madonna does a lot of dancing, which puts a lot of stress on your hip, times the amount of years. And you multiply that out, and that'll give you the possibility or probability that you may get arthritis.
So that's a 40-year career, and
yeah,
her odds are higher than the rest of us. And okay, so what is the recovery process like? So when you do get that replacement, I'm assuming that's surgery and they cut you open and basically go in and fix that cartilage. Then,
well, they replace the hip joint.
Okay.
So with a hip replacement, and again, I have not seen Madonna's x-rays, but from what she said, she had a hip replacement. So that would be replacing the ball and socket with artificial implants, usually metal and plastic. And once you do that, instead of having cartilage to rub on, you have metal and plastic to rub on. So that metal and plastic doesn't have any nerve fibers in it, and it's the pain is changed immediately. It's now, instead of having arthritic pain, patients would usually have post-surgery pain that will go away over time. But the arthritis is cured with a hip replacement. It's you can't have arthritis after a hip replacement
because it's no longer a human bone. It's
exactly it's semantically impossible to have hip arthritis after a hip replacement.
Okay. And so now that post surgery pain, post replacement pain, how long does it take for most people to not have it anymore? You said it goes away over time, and
yes, it's a progression. So you do cut through, soft tissue and muscle to get to the hip joint. So that has to heal, and that typically takes 2 to 6 weeks to heal. But then you have to get used to your new hip at the same time. You have to be able to learn how to use your muscles in a slightly different way to control a artificial hip that's going to be different than what they had before. So, I mean, typically a rehab, physical therapy rehabilitation process, can take up to 3 to 6 months. But the overall result can be really good. I mean, you look at Andy Murray is a tennis player who was previously ranked, number 1 in the world, I believe. He had a hip replacement, and he is back to playing competitive singles
at that level,
which is at a very high level. And so it is certainly possible to get back to a very high level of activity following a hip replacement.
Okay, so that kind of answers my next question, which was, over the years, hip replacement surgeries can actually reclaim pretty much 100%, you say, or close to 100% of previous mobility?
I would not say it's 100%. I do not think Andy Murray is going to win another major championship like he did before he had to have a hip replacement. But it can be like a really high level. Tom Watson is a professional golfer, a very famous one, who's won multiple majors. 8 months after a hip replacement, he made it to a playoff in the men's British Open golf tournament. So that's not the seniors. He was playing against, everyone, including 20-year-olds who can hit the ball 300 yards. He was playing at that level and made it to, he ended up second, but he, was in a playoff to win that tournament, which is, goes to show you that that's not rock climbing, but that's a pretty high level of activity that is possible, following hip replacement.
Okay, so as far as Madonna, whose performances are very, there's a lot of twists, and when you watch her, I saw her 2004 reinvention tour, and it was probably one of the best shows I've seen in my life. This woman is, and at that time she was in her 40s, but it was amazing to see, just she moved like a youngster, and so. Subsequent tours have also had extensive numbers where, there's a lot of kind of like mobility and moving around. So do you think that you'll ever get back to that same, ability to perform? Or is this something where she has to say, hey, at my age, I've accomplished enough. I may have to water down some of the dance routines and still do it, which I'm sure that's a possibility. But, and then the second part of that question is, will continued aggravation of this be good, or would that just end up training the muscles for her to be able to, continue this? Or would you recommend against putting too much stress on this new hip?
I think that it's with a combination of physical therapy and a choreographer who works with Madonna, I think that it would be very possible and probably likely that she would have a show that would be very, very good, and that you would not notice that there are some accommodations being made or some changes in the routine that would be an accommodation for her hip replacement.
Got it.
So
yeah.
I doubt if I went to see a Madonna show like a year from now, I doubt that I would be able to tell that she had a hip replacement.
Oh, wow. Okay. So I know you don't like numbers with the 100%. You definitely, it's not 100, but can you give me a ballpark? What is it? 90% of mobility, or, range back, or 80? Approximate.
For range back, you mean like how she can move her hip? Relative to how she probably was right before she had a hip replacement, her range of motion will be, like how she can move her hip will be better than how it was right before she needed a hip replacement. I'm 95% certain of that. Okay, because when you have enough arthritis to need a hip replacement, your range of motion is extremely limited. And people who are limping severely after hip replacement, after physical therapy and recovery, they're walking normally. From the range of motion from before surgery to after is
actually an improvement.
Better in the vast majority of patients. So I'm very confident that a range of motion would be better.
Great. And then as far as complex dance moves or movements, is there anything you recommend against doing that may cause other issues, or is this basically a new lease on life?
Well, I'd certainly, I'm sure that she has had extensive conversations with her surgeon who, knows her hip far better than I do. Typically, if you go into a splits position, like whether or not you had a hip replacement or not, you're actually partially dislocating your hip when you do that. So I doubt that
You
her surgeon,
recommend against splits.
would
Okay,
want
that's basic.
her to be doing that. But short of that, I mean, people can have a very, very active lifestyle after a hip replacement.
Mhm.
It is, certainly the best operation in all of orthopedic surgery. And there's a case to be made that it's the best operation ever overall. Like the success rate
Also,
is 97%. It's the highest success
wow.
rate that you can possibly achieve.
That's great. So it's pretty cut and dry. And a lot of, like I said, elderly. I do consider Madonna elderly. She is eligible for social security.
Anybody who's older than I, like only a few years older than I am, is not elderly. Okay.
But especially in your 60s, during retirement age, a lot of people get hip replacement surgeries, right? So it's very commonplace in that age range. Now, is this currently something that everyone knows about, or is this something that only when the pain gets so bad do they pay attention, or the arthritis gets so bad? And if it's not as prevalent, how can we make that an option? And is it affordable, or does Medicare cover it? I mean, these are kind of the practical questions I wanted to kind of explore with you.
Like not just Medicare, like nearly, there's not
every insurance.
There's not an insurance that I'm aware of that would not cover a hip replacement if it's necessary. Now they may have to investigate, and certainly people in their 40s and 50s get hip replacements too very frequently. Depending on if you have significant arthritis, that's the best operation to do for that. So it doesn't, like, a lot of times if you're in the 40s, it's like, well, I don't want a hip replacement. It's sort of like, if you have a car and you really like that car and you want to keep the car, but, it breaks down all the time and it would cost more to keep fixing it than to get a new car, then you get a new car. So it's sometimes like that where,
And do you recommend that though, Derek? Do you recommend that if there's severe, early on, just get it done and over with and get that hip replacement?
If there's no other option, so if it's mild arthritis where, it's not completely broken down yet, but there's still there's still cartilage left, and then certainly, if you're, in your 30s and 40s, you certainly would want to try injections and physical therapy, and possibly hip arthroscopy, which is a scope type procedure where you keep your own hip and sometimes change your hip through cameras and small instruments. Certainly those at a young age are reasonable.
Better, exhaust those options first.
Exhaust them, until it's not reasonable to keep doing that. So if those aren't, if those aren't reasonable options for you, or you've tried them and they didn't work, and you're in significant pain, you're limping, you have to use a cane, you're taking, pain medications for your hip, it's waking you up at night.
You got to weigh that.
Those are the times when, getting a hip replacement is the best option. And, certainly I would never push anybody to get a hip replacement, but it's, if it's nothing else that can be done, and the pain is significant for the patient, then a hip replacement is a phenomenal operation. The patients are, extremely happy after a hip replacement.
That's great.
Now the one thing about hip arthritis or hip injuries in general, the pain is not where people think it is with their hip. So a lot of times people, think their hip is like where the back pockets of their jeans would be, like
Yes.
that's their hip, or they feel this bone like, a little bit in front of that pocket, and they feel this, they can feel a bone there, and they think that that's their hip, and they think that hip pain would be there. Okay. Hip pain is typically in your front pocket. So if you're in your front pockets of your jeans, that's like where your hand would be. That's where hip pain is 90% of the time. So sometimes people will feel pain there and think it's something other than their hip. They think they strain their groin, or they strain their hip flexor, or something other than having a hip issue.
Got it. Okay, thanks for that. That's actually a really good nugget there. Finally, I want to leave you with this last question is, over the years, I know, as more and more hip replacement surgeries happen, it just gets better and better, obviously, because as a community, you guys can share best practices and this and that. So how far has that come over the years? And I'm hearing a 97% success rate right now. So very safe and in fact, life-changing for so many people. But are there any things we should be concerned about that are still in this hip replacement surgery field that you guys are trying to refine and fine tune, or is it pretty much the best it can be now?
No, there's a lot of things that are still being investigated. Like it looks like on Madonna's like picture that she posted, which I looked at, it looks like she had an anterior approach hip replacement. There's different ways that you can do a hip replacement, and there's some very early data that suggests that might be a better way of doing a hip replacement than other ways. So we're constantly evaluating like different ways to get to the hip to do a hip replacement. There's robotic surgery that is becoming more and more popular, that gives us more precision, more accuracy on, how do we put that hip replacement in? How do we get the implants, like the socket implant and the femur implant, in as good a position as possible? Because if you put the implants in a good position, then the results are going to be better than if they're not in good position. We're also, really always looking at different types of surfaces. Like there's different types of metal, there's different types of plastics, there's different types of ceramics. There's different ways that things that you can put into the hip that would be slightly different. The problem with that is that there's about 97% success rate early on with hip replacement. It's a phenomenally successful operation. So you're thinking about like an A+ hip, and like a 97% would be like an A to an A+, right? You're thinking about like, how do we make an A to A+ hip better? And it's really hard because it's already very, very good.
So it's fine tuning those things. And real quick, I forgot to ask you about physical therapy. Does the physical therapy after the hip replacement help, and then retrain those muscles to adapt?
I mean, it's a vast majority of patients in our practice have hip physical therapy after hip replacement. And it really depends on what your goals are. So if your goals are you want to be able to walk around, the block a couple of times, and maybe go to your garden and do some gardening. Okay, well, that's one set of goals, and you can do physical therapy to get you to that set of goals. I mean, you can also do physical therapy to get you to be playing professional tennis. So that's a different set of goals. That's getting to being able to play professional tennis is a lot harder and takes a lot longer than if you want to walk around the block and do some
So
gardening.
Madonna, getting back to her dancing, is going to have quite a bit of physical therapy and training to get accustomed to the new hip to do those performances, but it is possible. That's our bottom
Exactly.
line, right?
Yep.
Great. Any final words, Derek, for the Hollywood Times audience? Love to hear any thoughts around this topic and what you're doing.
Well, I think that hip injuries and hip arthritis is a very, very common problem. I would say that if you're having pain when you sit for 30 minutes and it's in the the front pocket of your jeans area, or you notice that you're not able to put your socks on the same way and that you have to twist your leg differently to get dressed in the morning, that would not be something to ignore. That would be something that you would want to at least see an orthopedic surgeon about, because sometimes there are treatments that can delay or possibly even prevent further deterioration to arthritis and needing a hip replacement. And if you've kind of ignored that and you do need a hip replacement and your doctor says you have severe arthritis and recommending a hip replacement, then that is a phenomenal operation to do at that point.
Great wise words. And Derek, where can we find your practice online? Are you on social media, especially for those listening in from the DC Metro? Where can they find you?
I actually have patients from around the country. So you can find our website at www.nirschl.com. But I'm also extremely active active for an orthopedic surgeon on Twitter. And my Twitter handle is at Dr. Derek Ochiai. That's DRDEREKOCHIAI. I post a lot of, probably more than a lot of your listeners may want to look at, but I post a lot of hip conditions and potential treatments for that. And Twitter is really a passion of mine that I want to get the word out on how we can treat hip conditions actually before they need a hip replacement.
Oh, I love the preventative medicine and a true subject matter in your field. So thank you so much for joining us today. And thanks for sharing your wise words of wisdom. And when the article is up, I'll shoot you a link. I'll tag you on Twitter, actually. So thank
great.
you so much.
Yeah,
okay.
well, thank you.
Have a wonderful weekend. Thanks, Derek.
You too.
Bye-bye.
Bye.